Imagine having sharp pain in your side, so intense you can't move. Back pains, it hurts when you do move. Having your doctor tell you is just a normal side effect of your menstrual cycle. However, the pain just gets worse and worse, and you decide to get a second opinion. Then you find out that you have endometriosis. You think, what in the world is endometriosis? It is a painful condition when the woman's uterus cells grow in other areas of the body and cause adhesions, and those adhesions cause pain in and around your uterus. It can also lead to cysts in and around the uterus. For women who are in pain and they have no idea why, since it's very hard for your doctors to figure out that someone does have endometriosis. Figuring out it is endometriosis is like finding the needle in the haystack. It can be very difficult to find. And there's no cure for it, so you just have to deal with it. It is also the leading cause for infertility in women, according to the Endometriosis Research Center. Balancing diet and exercise can help keep a woman who has endometriosis fertile and can also decrease the pain she experiences. Endometriosis can be hard to diagnose. According to endometriosis.org, there can be delayed up to 12 years in diagnosing endometriosis. It can be frustrating to women when they go to many doctor appointments and never find out what is wrong. There are a few things that can help diagnose endometriosis. There are pelvic exams, MRIs, ultrasounds, and also laparoscopic surgery in which they do a biopsy of the tissue. Also, diet, exercise, and massage can help reduce the pain from endometriosis. And living well with endometriosis says removing wheat, red meat, and caffeine and alcohol. A quote in Living Well with Endometriosis says Ms. Jefferson Hills has found that in her own practice, when wheat is taken out of women's diets, pain subsides in 80% of all patients. In Living Well with Endometriosis spoke of a study done in the University of Milan. The study found that in women who had a high consumption of red meat, there was an 80 to 100% more increase in endometriosis. Coffee has also been found to increase estrogen levels in women, which in turn affects endometriosis. It also affects liver functions that can help get rid of excess estrogen. And drinking alcohol also makes it difficult for the liver to get rid of excess estrogen. Massage also does help with relieving the pain from endometriosis. I personally have experienced this. Massage relieves tense muscles, which are constricted blood flow and compressing blood vessels. I've found this to help me the most from my back pain from endometriosis. When I get a massage after a bad episode of endometriosis, it's like an hour in a world without endometriosis. This quote from Julie in Living Well with Endometriosis seemed to have the same experience I did. In attempts to feel better, I tried acupuncture massage, which was absolutely wonderful for temporarily relieving the pain. And just even a temporary relief from pain with endometriosis can be amazing. Exercise also helps. Exercise helps release endorphins, which are natural pain relievers. Endorphins block pain signals to your brain. It's best to add exercise in small amounts. However, exercise can have a tremendous amount when dealing with the pain from endometriosis. Exercise is like a warm winter coat if you have endometriosis. It doesn't warm up the frigid air, but it certainly does make you feel better. Infertility and endometriosis go hand in hand. However, endometriosis does not equal infertility. Endometriosis does not mean a woman cannot get pregnant, it just means getting pregnant is that much harder. I found information on endometriosis.org about one study done. In one Australian study involving 3,895 women with endometriosis, 54% of women who tried to get pregnant in the first year did not succeed. However, 70% of them do have at least one child. The Endometriosis Research Center also talks about endometriosis and infertility. While endometriosis can cause infertility in approximately 35% of women with the disease, with the right treatment and partnership of the right healthcare professional, pregnancy can certainly be achieved by a woman with the disease. Living Well with Endometriosis informed me that 10 million women in America do have endometriosis. Since there is no cure for endometriosis, it is important to change your diet to one that benefits endometriosis. Also, exercise is important as well to keep episodes at bay. And even though endometriosis is a leading cause of infertility, It does not mean you can not get pregnant. It just means having babies makes it is more difficult, and it may take more time to become pregnant.